Syphilis is a bacterial infection that causes lesions and bumps. In severe cases, it can cause brain damage or even death. In the past 3 years, the number of syphilis and congenital syphilis cases in Louisiana has increased exponentially, prompting the CDC to recommend testing to reduce case numbers. Here's a look at why the infection is spreading so quickly and what can be done to stop it.
An outbreak is sweeping the American South. Venereal diseases are on the rise among almost all demographics. Syphilis rates in particular are skyrocketing.
Numbers from the CDC show a surge of sexually transmitted infections in the United States with no signs of slowing.
We're seeing this spike in women, pregnant women in counties across the U.S., which is unusual.
Syphilis is a bacterial infection caused by Treponema pallidum. Cases peaked in 1950, but more than 70 years later, the U.S. is experiencing another boom, especially in southern states like Louisiana.
The problem is that sometimes it goes undetected because it doesn't cause any symptoms.
Dr. Edward Vayon specializes in maternal fetal medicine at Women's Hospital. He says the lack of detection is contributing to the boom.
It can be a lesion or a bump. It's painless, and sometimes if it's inside the vagina or on the cervix, the patient's not going to know that it's there. Then what happens is that this lesion will heal in 2 to 3 weeks, independent of whether or not the patient received treatment. Okay, so the lesion is going to heal and go away, but the syphilis infection will still persist.
In Louisiana, cases of syphilis are beating national records. From 2020 to 2021, the diagnoses increased by 36%, meaning that for every 100,000 people, about 22 had the disease. Louisiana ranked 11th in the country for highest syphilis cases in 2021. When adult diagnoses increase, so is the likelihood that fetal cases will increase too.
How is it transferred to a child?
So one of two ways, baby can become infected. So either by the organism actually crossing the placenta. So that means during the pregnancy, it's in the mom's bloodstream, then it crosses to the placenta and infects the baby. That's the primary way, and it can be as early as 6 weeks of pregnancy. Okay, so it can be any trimester. It's still just as serious. Okay, although obviously the longer that it was present, the more chances there are to cause the baby significant problems.
The second way is through delivery. If the mother has a lesion or bump on or near her cervix, the fetus can come in contact with it.
If a patient has latent syphilis, okay, and they come to the hospital and deliver a baby, well, that baby is going to be sent home before we realize that it actually has syphilis, because it can be even 3 to 8 weeks after delivery before some of these children have any symptoms of it.
And the symptoms would be the same as an adult?
So they're different symptoms, although some are similar. A characteristic rash, okay, is one of the most common things that's seen. They can also have flu-like symptoms. And then this can progress. It goes through stages also. If it doesn't get treated, it can progress to your much more severe things, which is permanent brain problems, low IQ, blindness, abnormal teeth, problems with their bones, liver enlargement, lots of terrible things.
Congenital cases are peaking in Louisiana too. In fact, the state is ranked 3rd for diagnoses. Last year, the Department of Health recorded 115 cases. In a report, the Department of Health said that a lack of testing and prenatal screenings is causing the disease to spike again. Because the infection is so hard to detect, it's almost impossible to know if someone has syphilis until it's far along. Another issue is reporting.
If a patient that's pregnant gets screened, they should all get screened in the first trimester, okay? If they're positive for it and it's confirmed, then they'll get treated with 1 dose of penicillin, 1 dose of bicillin, okay? And then it's crucial that they get retested or rechecked for it later in the pregnancy, because you can get reinfected.
Penicillin is only a treatment, not a vaccine, so it's crucial that mothers always get retested.
It's preventable, 100% preventable if patients get appropriate screening. So that means if they get appropriate prenatal care from the minute they find out they're pregnant, they should start seeking care with a doctor so they can get screened properly so that it can be treated and therefore prevented.